Hi, I'm Dr. Vicki Kelsey, and this is Dr. Charles Kelsey, and I'm going to talk about migraine and whiplash. Whatever activity that occurs that causes whiplash is traumatic enough, but unfortunately many whiplash sufferers experience physical and psychological symptoms that can make the experience even more traumatic. These symptoms can range from very mild, such as a dull headache, to extreme, such as severe vertigo. They also may occur right after whiplash and only last a few minutes, or they can take a month or even 6 months to surface before lingering for years. If you think you've suffered whiplash after an accident or injury, see your doctor to begin treatment right away in order to minimize these side effects. Neck pain. It's not just the head that can be injured when whiplash occurs. The act of snapping your head violently forward and backward can cause damage to the soft tissues of the neck as well. Therefore, one of the most common symptoms after whiplash is neck pain and stiffness. These may be present as soon as whiplash occurs, or they may take up to 72 hours to surface. Many people walk away from whiplash injuries feeling fine, only to experience neck pain and stiffness a few hours later or even the next morning. If you have or think you have whiplash, refrain from any strenuous motions or activities for at least one day, even if you feel fine. Headache. Headaches are not normal. They're a sign that something is wrong. Your body is designed to be free of pain. Feeling good is a normal state. Feeling throbbing, pounding pain in your skull that won't go away is not normal. Headaches are the second most common symptom in whiplash sufferers. The headache may start right away or may take some time to show up. Some people actually suffer from late whiplash syndrome, meaning symptoms such as headaches can last for years. Vision problems. Though it's not as common, fuzzy or blurred vision can occur after whiplash. Some people find their vision seems a bit out of focus. Others experience a lot of blurring. Some people seem to have problems focusing when they shift their vision from one point to another. The latter occurs most frequently when victims quickly move their eyes from one focus point to the next. Whiplash victims complaining of eye problems typically have one or more problems identified if the condition is bad enough that they go in for an eye exam. The most common problems are abnormal rapid eye shift, also called nystagmus, a delayed reaction when tracking a movement with the eyes, blurring in one eye, and not being able to bring the eyes together when items are placed close to the face. I know we don't usually think of being able to cross our eyes as a good thing, but it is an essential part of being able to do close focus work. Dizziness. Whipping your head back and forth can be very disorienting for most people. The dizziness may occur for a moment or two after the whiplash occurs, or it may be long-lasting, in which case it's called post-traumatic vertigo. This term applies to any instance in which a victim experiences dizziness or vertigo for more than 3 months following a head injury or a neck injury. This condition may continue for years, although approximately 75% of cases resolve within 1 year. Memory loss. Memory loss can occur after whiplash, although it's not extremely common. This memory loss may be accompanied by irritability or lack of concentration or focus. Concussion or mild traumatic brain injury can cause a whole host of cognitive problems with thinking clearly learning, memory, as well as multitasking. Concussion or mild traumatic brain injury often results in sensitivity to light and sound. Many VIC sufferers have personality changes affecting the lives of their family and friends. The effects of violent shaking on the delicate structures of the brain are not yet well understood and seem to show wide variability. To sum all this up, headache often occurs after whiplash and can persist a long time, especially if not treated promptly and correctly. It can be accompanied by neck pain, sometimes vision problems, dizziness, or memory loss. If you are experiencing this problem, the best way is to begin with conservative care such as chiropractic and brain-based therapy and metabolic care. We have over 130 hours of specialized whiplash courses each, plus metabolic and neurologic courses, and real compassion for your suffering. We locate areas of the spine that are not moving properly. We notice spinal curves. We look at your posture and your ability to turn and bend. Spinal adjustments can help normalize spinal function, help restore essential spinal curves, improve circulation, and reduce nerve irritation. Many headaches are the result of a loss of curve in the neck, affecting nerves, muscles, and blood supply to the head. Also, after a thorough neurological examination, we determine which part of the nervous system is not functioning properly. We treat patients neurologically and metabolically. We run lab tests as necessary to see what is triggering your migraine headaches. Our neurological testing will find out which brain areas are malfunctioning, and we will design your individualized program of brain rehab. Watch the following testimonials, fill out the forms, and get in touch with us.